The next topic we're going to be talking about today is hemochromatosis. So like we always do in our medicine lectures here, we talk about definition. After definition, we're going to talk about what's causing this disease, and then we're going to move over to talk about what the patient is going to present with, what the history and the physical symptoms are going to be, how we're going to order labs, and we're going to treat this. So what is hemochromatosis? Like we always do, we break words into pieces. So I wrote it up here, hemochromatosis, right? It's the excess deposition of iron. Excess deposits of iron in the body, which it's not supposed to. So what really causes this? So if you look at the word heme kind of hemoglobin, and if we kind of, this, I always try to drive people nuts with this, but this would be like a structure of like, this is not absolutely correct, but the hemoglobin ring has iron in the middle, bind to this porphyrin rings, right? Which is balanced by histidine, which is an amino acid, and oxygen binds up here. But don't worry about this. This is not the point. The point is to show you a hemoglobin molecule has these 4 globin molecules, which has the porphyrin ring, which kind of sits in the middle, and then the iron is kind of sitting at the dead center of it, which is balanced by an amino acid, and the oxygen binds to the iron, and then we got nice carrying pigments, right? But in this case, this is the culprit. Something is going wrong. Iron is doing what it's not supposed to do. So what exactly is really going on here? What causes this? So breaking down the word before we go again, chrom means color. So hem from hemoglobin, iron deposition, excess amount of iron. So what really causes this? It's a genetic mutation. This is like one of the super like high yield 99.99 percentile information. If anybody ever tests you this is insane. But it's a mutation. It's a missense mutation of cysteine, of cytosine actually, I'm sorry. Where were we? Here. Right? Of cytosine amino acid into tyrosine. So when actually cytosine, you have actually 2 cysteine, actually cysteine. When this mutation occurs at the molecular level, this causes a malfunction, and this is what's going to cause your body to be reabsorbing more than enough iron. This is a ridiculous amount of information, but just kind of, we always try to talk where things are coming from. This is the mutation in the HFE gene, the hemochromatosis gene. So Fe means iron, H for hemochromatosis. So that's the gene, the protein that's mutated, and once the protein which carries iron is mutated, what happens? You start to take more than something normal is supposed to be. So let's go ahead, now that we really know what causes it, and before we go ahead, let's talk about where iron is absorbed in our body, right? So when you take iron goes through your GI tract, goes eventually to your stomach, and in your duodenum, iron starts to get absorbed. You start to absorb the iron, and iron goes through the GI tract, it gets absorbed back into the body, it goes straight to the liver, and is stored as ferritin. So when iron is absorbed, it's stored as ferritin. But something is wrong with these guys. I call them the Iron Man. Okay? So when they come into the hospital, what are they going to look like when they come into your office? When they first walk in, let's take a history on this patient. They're going to look brown skin, bronze. They look like Iron Man. Right? Might not be able to draw them well on this one, but right? They're gonna have bronze skin. This is one of why do they have bronze skin? Because they have so much iron in their body, it starts to spill onto their epidermis, and it starts to stick there. And you start to see them, why? Did you go to the beach and tan? They're like, nope. I just look like that, right? So that's the first clue. Something is not wrong. The entire head to toe, they look like bronze. So, but what are they going to really be complaining about? Chief complaint. They can come into the office and talk about, Doc, I've just been tired lately. I'm weak. My joints feel like achy. And I'm young. I'm only 42. This is why. This is common age grade. I'm 40 years old, right? So they're like, I'm tired. I'm feeling fatigued. You know, I'm kind of just, and you start to work them up. But the only key you've got is to see that they're really looking like pale, like bronze in color. So now that we'll know exactly what the pathophysiology is, which is the mutation in the HFE gene causing excessive reabsorption of iron to the body, it's the deposition of this iron that's going to give them all these symptoms. So hemochromatosis can cause deposit, right? So that's the mnemonic. Hemochromatosis can cause deposit. Now, the C we're going to talk about is going to cause cirrhosis. The deposits are going to be in every part of their body. So let's check this out. I said the guy's going to be tired. He's going to tell you, you know what? My sexual life is not that great. You know, my wife, we don't really do too well. So how are you going to be able to figure out what's going on? So these people are going to be complaining about tiredness. But before we move on, who are the people that normally get this? Europeans. Very common in them. You know, usually in their fifth decade, in their 50s. Usually a 5-year-old boy is not going to come to your office and start complaining of any kind of these problems. So we already talked about the causes. Now let's keep focusing on what the history is going to be. And now the history is going to take us back to the pathophysiology of why they complain of all the symptoms. So I said the mnemonic is hemochromatosis can cause deposit. CCD, cirrhosis, CHF, and diabetes. So, but how does this all make sense? Now let's talk about all the symptoms one at a time. So we got our friend here, Bob. It's going to be our patient. He's just not sitting there, okay? Bob is going to come into the office. He's going to be a 50-year-old male. Why is he male? Because this disease is common for, it's an autosomal recessive disease. It's an autosomal recessive, which means only males can get it, right? Because once they get one of this gene, they're screwed. Females can get it too, but it's always common in males. Because females got that one X, except they inherit from their father again, they get autosomal recessive. But males are definitely guaranteed to get it, because once they pick up that gene on top of their X chromosome, it's over. Y is just for balls. I mean testicles. Alright, so it's an autosomal recessive gene mutation. We talked about that. So they come in and say, Doc, my joints has been hurting. They're like, arthropathy. Why? Look, the iron, the problem with iron causes a lot of redox reaction, reduction oxidation. So iron definitely makes a lot of free radicals. And you know from basic pathology and pathophysiology, what do free radicals do? They cause inflammation, they cause damage. They damage your DNA, right? They get DNA to come together, they cause a lot of bad stuff. So it's called constant inflammation. So what happens? This iron starts to deposit. So we came up with a fancy name for that kind of iron, right? We call it hemosiderin. So hemosiderin is ferritin, which is the protein that stores iron, with a cup of also ferritin that's already damaged because there's too much iron it's absorbing, and some other stuff like, and that whole complex is what causes hemosiderin. And this hemosiderin, now that I'm going to stop talking about iron, always remember when I say iron is hemosiderin, it's a fancy name. Every time in medicine we try to realize, we have to know what we're talking about. We change the language, we change the words because we don't want you to know what we're talking about. So we say hemosiderin, right? As the protein complex starts to deposit, form free radicals. So where's it going to go first? Well, it can go anywhere. Let's start what? In the joints. That's why Bob is complaining about arthropathy, right? It damages the joint because arthritis a little bit. It's like a complaint of knee pain, right? Next, They complain of abdominal pain, right? Because inside the GI tract is not the place iron is supposed to be leading. So free radical generation inside the wall of your GI tract, it causes pain. That's a lot of pain. So that's what they're coming in for. Doc, my belly hurts like a son of a gun. But they're not done yet. You start to worry about, okay, Doc, I notice I've been eating a lot. We call that polyphagia. And they be peeing their brains out. Polyuria. And they've been drinking a lot. We call that polydipsia. What is all these three symptoms fall into? Diabetes mellitus. Why do they have diabetes? We call it bronze diabetes. It's the pancreas that got hit. It's not too much hemosiderin. Remember, it's the hemosiderin is depositing all the tissues in the body. So if they go to the joints, you get arthropathy. When they go into the pancreas, bam, guess what? They're going to develop diabetes because it's going to damage all those outlets of Langerhans that make insulin. No more insulin, elevated glucose, hypoglycemia, osmotic diuresis through your kidneys. You start to pee your brains out. You get dehydrated, so you got to eat more. The body's starving because it doesn't have enough glucose. You start to eat a lot more. They have hypoglycemia, so it causes diabetes. You think they're done? So now we got rid of the pancreas. We talk about the joints. This guy was complaining, Doc, my little pee-pee hasn't really been, Yeah, I know. They're not having good erection. Their testicles, their balls are this small. I know. I have to make it X-rated. That's how far I can go with it. They get testicular atrophy. Let's explain why that happens. The pituitary gland, what is the function of the pituitary gland? You got the pituitary, right? You got the posterior and the anterior pituitary, right? Flat pig, we're going to talk about this in endocrine. But what? You make LH and you make FSH. Eventually these guys are going to make testosterone, which are coming from the Leydig cell, right? The Leydig cell, which are on the Sertoli cells, which are also, which are also inside around the testes. These guys are gonna be making testosterone. If we don't have this, we know LH, right? Luteinizing hormone, no FSH. Why? Because we've knocked out the pituitary gland. The hemosiderin comes in, binds, bumps through radical, damages their pituitary. They can't lift it up. They can't point and shoot. They get what? Erectile dysfunction. So that's number 4. I'm pretty much sure the guy's not going to be too excited talking to the doctor about erectile dysfunction. But you know what? At some point, he's going to let you know, listen, I'm not performing as well as I used to back in my 20s. Yeah, it's the iron. What other things they're going to develop? The arthropathy, I want you to realize this is going to be depositing their MCP. Where's the MCP? This is the MCP joint, the metacarpophalangeal joint, right there. So it's going to hurt, okay? This is the PIP and your DIP, right? So you want to, this is where they're going to be having a lot of pain. What else? This iron is not going anywhere. It's going all over your body. It's going to go to the heart. When it deposits in the heart, iron is not the coolest dude. It's going to do this. What do you think that looks like? It's going to cause everything to be fibrosed, hypertrophied, kind of damaged. It's going to be stiff. Stiff means what? Restricted. When they're restricted, they call it restrictive cardiomyopathy. So, restrictive cardiomyopathy. Now, the problem is once you damage the wall of your heart, that's the problem. It's like high blood pressure. You get hypertrophy, and eventually the muscles die off. When these muscles die off, they're going to go into congestive heart failure, which is just equivalent to dilated cardiomyopathy. Because what happens is it used to be thick, and now the heart can contract. The myocardium starts to die off because of the deposition of iron, and this is what is going to kill them. But eventually, those muscles become thin. And now the heart muscle gets really, really thin, and it can't really what? The ejection fraction is going to drop. It starts off thick, but eventually it gets really thin, and the heart looks like a ball, and it can't really pump out a lot of blood. So you get CHF. what do you think is going to happen to their liver? Forgot to draw the liver in here. Because all the iron is being absorbed and it goes through the portal system first, it's going to deposit into the liver, start to kill off the hepatocytes, start to kill them off. What's going to happen? Free radical constantly generated inside your liver is not cool. So what will happen? You develop liver cirrhosis. Right? So if you go back to our liver function test lecture, you will see one of the causes of liver cirrhosis is hemochromatosis. Cirrhosis is a precursor to what? Hepatocellular carcinoma. So if you live long enough and they develop cirrhosis of the liver, they're going to develop liver cancer. You want to know that complication. That's extremely important. So we've talked about all the symptoms they're going to come in with, right? Hypogonadism, right? They're going to have also testicular atrophy. Aside from the pituitary being knocked out, it deposits into their balls, it shrinks. Also get testicular atrophy because loss of testosterone, abdominal pain. Now, this all makes sense why patients are coming. And the skin is going to be what? Bronze looking. So we can put that the skin is bronze pigment. Literally, these guys, they can have up to 50 grams of iron in their body. Like they'll walk through a metal detector at the airport and the alarm will go on. And you're like, I have nothing on me. I'm really completely naked. Like, no, there's a metal in you. Literally, the Iron Man. So you got to watch out for these guys. So now that we figure out what they're going to present with, right, their signs and symptoms, how do we diagnose it? Right? Because that's your job. They don't know what's going on. They don't know they inherited the wrong gene, right? They don't know they have so many free radicals in their body. They don't know they have a lot of iron. So diagnosis. Now, are you going to order iron first? I hope you're not going to do that. Because iron says nothing. What you want to order is their ferritin level. Iron is stored as ferritin in our body. So that's what you want to order first. The ferritin level is going to be skyrocket high. Because they're reabsorbing more than they need. So ferritin level is going to be ridiculously high. What do you think the serum iron is going to be? I think that's not rocket science. We've just been talking about this same guy is going to be high. Then we're going to look at what? Another thing you check is the serum transferrin. So let's look at it. Serum, which is inside your blood, transferrin is the transporter, right? So somebody's got to take the iron from wherever it's been stored inside your body. You know, it's in the bone marrow, or it's in your liver, right? It's got to have a little protein that has to carry it, right? What do you think is going to happen with that protein if you have so much iron just floating all over the place? And this guy's going to be tired of carrying iron because there's so much. So what do you think is the saturation, the serum transferrin is going to be? It's going to be low. Because it's already saturated. You don't have enough of them anymore, right? All of them are saturated with iron. So serum transferrin levels are going to be really, really low. So how about the saturation, the percent saturation of iron? That's also going to be very elevated. So that's one more thing. Increasing serum, percent saturation of iron is going to be high. Transferrin is going to be what? It's very high, but they're going to have low what? Serum transferrin, which is the guy that's supposed to, because what happens? Everybody's already saturated with so much iron, it's no point. Now, what do you think is going to happen when we take a look at their blood sugar? They're going to be glucose intolerant. Why? Because they have diabetes. So if we have their blood glucose, it's going to be skyrocket high. They're going to be in the diabetic or glucose intolerance range. Liver function test, we can check the liver. AST can be mildly elevated. If they damage a lot of hepatocytes, the ALT might also be elevated. So that's another thing you might also want to see. But how do we really diagnose this condition? The only way we can diagnose this is by doing a biopsy. The most accurate test. Right? To know exactly what's wrong with them is to do a liver biopsy. When you do a biopsy, you stick a needle, you stick it into their belly, right into the liver. You look it under the microscope of pathology, like, look at all this hemosiderin all over the tissues. That just gives you the diagnosis. How do we treat, right? You're not going to send them home like this, are you? Oh no, that's bad news. You're going to kill them. So the only way we can treat them is by phlebotomy, right? These guys are the guys you always see at the Red Cross. They always donating their blood. It's not always all of them. You know, people donate their blood all the time, but you bleed them out. Because when you bleed them out, now the body's got to make new hemoglobin, and each hemoglobin is iron, right? So every time they need iron, you start to decrease the amount of iron you know that's left in the body. So you bleed them out. They come in every 3 months and they give blood. So you give it every 2 to 3 months, or they do it weekly until the iron levels drop down. Another drug you can give, which you all should know, is the ferroxamine. Right? If you look in the middle, that's iron. What does it do? It's an iron binding agent. You give them this drug, it binds to the iron, they poop it out of their body. So that's how we treat it. So now we've talked about hemochromatosis. That's all you need to know. So what kind of infections are patients with hemochromatosis more susceptible to? Iron-loving bacteria. So this is like high-yield board question. They're highly susceptible to infections. And there's 3 organisms that's very common that causes it. The first one is Listeria monocytogenes, which we treat with ampicillin. The reason why they're susceptible to this infection is because the macrophages, right, are filled with a lot of iron. Since these macrophages are filled with a lot of iron, they can't really phagocytose these organisms. So this guy gets to tumbling motility. Remember that from micro? Yeah. He gets to tumble around and cause infection. Vibrio vulnificus is another iron-loving bacteria. They love to eat iron. They're going to be flourishing and having a good time at the party. But the problem is you're not going to be able to fight them off. Right? That's a problem. You're going to be having a lot of diarrhea with that. Yersinia is another organism you want to watch out for. Enterocolitis. Right? Entero means the GI tract. Colitis, inflammation of the GI tract. Watch out for Yersinia. It causes diarrhea also. So these are the 3 organisms that causes infection in these patients. And always remember, now, in summary, what would you talk about today? Hemochromatosis is the genetic mutation in the HFE gene. These people absorb so much iron in their body, too much iron. All you have to know is think about where things deposit. If it deposits in the brain right in the pituitary, what happens? They get testicular atrophy. If it deposits in the heart hardens up, they get restricted cardiomyopathy. Eventually, it dilates, he's about to die, he gets congestive heart failure, they get short of breath, they can't breathe, they can't lie on their back at night. Right? Also, when they deposit in the pancreas, they develop diabetes. In the skin, bronze skin, hyperpigmentation, right? If it deposits also in the GI tract, they get the abdominal pain. We talked about if it deposits in the liver, what do you develop? You develop cirrhosis. And one more thing I forgot to tell you in this lecture, you deposit in the adrenal gland, you get adrenal insufficiency. So this is a serious disease. You want to catch it early. And what do? You bleed them out and give them the ferroxamine as maintenance therapy. All right? That's the end of our lecture. Thank you. Hey, thank you so much for watching the video. I hope you learned a lot. Are you studying for the Usmle Step 1 or Step 2? Are you studying for the NCLEX or you're currently in nursing school as a nursing student? Are you a PA student currently in school or studying for your PANCE exam? Or are you a nurse practitioner student or trying to take your NP board exam? Listen, I've got super awesome content for you. If you truly love this video and it simplified your learning process, I want you to check out my website below. I've listed all the list of exams, whether you're studying for any of this board exam, and all I want you to do is click on the link right now below so that you can take you directly to my website. For USMLE, just go to smashusmle.com. For NCLEX, go to crushnclex.com. And if you're studying for the PANCE exam, the nurse practitioner exam, or you're studying for your internal medicine board exam, just click below and it'll take you directly to ftplectures.com. Listen, I can't wait to help you. If you need to get in touch with me, just get to my website, you'll be able to reach me directly, and we can work together one-on-one. Listen, you're super awesome, and my goal here is to help your dream come true. If you want to be a doctor, want to be a nurse practitioner, a registered nurse, or physician assistant, I'm here to help you get to that next level. With your medical knowledge, let's save the world together. I love you guys. You guys are super awesome, and do not forget to click on the link below to be able to get to my website. Also, don't forget to subscribe to my channel. You guys have a great day. Let's go.